Radio.
Hello everybody. As we talked before about the effects of radiation and biological effects of radiation, and today we will start how to protect ourselves in radiation application like operating theater or fluoroscopy. Okay, what's the protocol that we have to use? Okay, during operating theater or during fluoroscopy. It's important to know how to protect yourself, what's the source of radiation, okay, the real hazard coming from patient or from X-ray tube itself. So today we will talking about very important lecture, okay, about operating theater, CR. As you can see that CR used in fluoroscopy or used for operating theater, okay, to see. To guide you for operation, to put stent in patient or put fixation process, or to see what happened in the patient during operation. Okay, you will find here the CR, okay, and you will find this X-ray tube and image and intensifier, and this is X-ray table, and this is monitor. Okay, to see all what happened in during the operation or inside the patient. Okay. X-ray tube, as we discussed before, that X-ray tube is a source for X-ray, is a source of X-ray, and we discussed before that the X-ray production that we use cathode and anode, okay, and using kV and milliampere, okay, you set these parameters, okay, to control the output of X-ray. If we increase kV value, okay, the penetration power for X-ray will be increased. If we increase milliampere, okay, the amount of photons or amount of X-ray photons will be increased, okay? So we have kV and milliampere parameters, okay, affecting on the X-ray production in CR or any X-ray machine, kV and milliampere, okay, affecting on the X-ray production. So the hazard coming from
Excuse me. KV is the amount of electricity you put it into.
not amount of electricity, but kV mean X-ray tube is composed of cathode and anode, okay?
Yeah.
This cathode is the source of electrons, okay? It's connected with milliampere. When we set milliampere with value, certain value, cause heating for cathode, for filament, okay? This heating causing libration of electrons on the surface of filament, okay? So you need to move these electrons from cathode to anode. To accelerate this electron or to move this electron, you need kV. So this kV or potential difference between anode and cathode is important for acceleration the electrons from cathode to hit anode, okay? This acceleration increased when kV value is increased. If we bought kV value 80 kV or 100 kV or 120 kV, what will happen? The acceleration increased, and due to this acceleration, okay, that the probability of interactions with electrons and anode will be increased, and the X-ray photons which are produced from anode, okay, the penetration power of X-ray will be increased. Okay, so kV affecting directly on the penetration power of X-ray photons, but on increasing value of milliampere, what will happen? If I increase the value of milliampere, what will happen? I found that the amount of heating for filament will be increased. So the electrons which are liberated from filament will be increased. So the probability of interaction of electrons with target or target atoms will be increased. So the amount of photons which are produced will be increased. So milliampere affecting directly on the amount of photons of X-ray, but kV affecting directly on the penetration power of X-ray photons.
So in other words, in order to increase the current of electrons, we need to increase the milliampere
Yes,
current
flux.
to make it more.
Yes, more amount.
But to make them more
Penetration power,
kV.
Yes.
So for example, for the bond, to expose the bond for us,
Yes.
we need to increase kV on the milliampere.
Okay. It depends on the image formation for X-ray or CT. Okay. For the image for X-ray for chest, like example, you will find that bone appear in white, okay, and you will find that lung appear in black, okay. Why?
Because there is no resistance between the lungs.
No resistance mean
For the electrons, they're penetrating fast.
photons which incident on the patient absorbed in high density material, okay? So bone will absorb a lot of radiation. So the transmitted radiation, which are incident on the film will be very low. So these photons have no ability to burn the image, to make it black, okay? So the transmitted photons are not enough to black the image. So you will see the bone in white color, okay?
Because photons are absorbed.
Absorbed.
Not penetrating.
Not penetrating. But if you find cracks or fracture,
They penetrate.
yeah, okay, it appear black because they are penetrating for X-ray. So the image will be black in this region or in this point. So you can detect if there is cracks or not, or there is fracture or not. Okay. So if I increase the penetrating power, okay, so the absorption will be reduced. The penetration power increased, so absorption reduced.
Yeah.
Okay, so the image will be more dark, more black. So no need to increase KV. It's a very important question you ask. Okay, that if I want to image bone or iodine contrast, like example for patient for barium, for rectal element, I have to increase KV. No need to increase KV, because if you increase KV, penetration power will be
Too strong.
too strong. So
No.
it will affect badly on the image. I want difference between bone or iodine contrast and surrounded tissues. Okay, that's very important. The difference in absorbance, okay, reveal good image. Difference in absorbance, very important. So increasing KV. So nowadays a lot of papers talking about decreasing KV in case of angiography. In case of angiography, if you want to see the vessels or angio or arterial system very well, you have to decrease KV, because decreasing KV, less absorption, okay?
And better picture.
Yes. So we'll make difference in absorbance between iodine contrast and other tissues, so you can see arteries or contrast media very well. Okay? But you have to increase milliampere for heavy patient or fat patient. Okay? For fat patient. Okay? It's important to increase the number of photons. Okay? To increase the probability of interactions. Okay? To increase the transmitted photons to get good image quality. But milliampere will increase the dose of patient.
Absorb those.
Yes, will increase the absorbed dose of patient.
So we should be rather reluctant to increase the milliamperes
Yes,
as low as possible.
yes, you have to make an optimization. If the patient, okay, is thin or not fat, okay, you have to, no necessary, okay, to increase for milliampere, okay, if thin patient. But if the patient is very fat, okay, you have to increase milliampere or increasing KV.
But when you have the automatic, for example, you know, in the CT arm, the SC arm has got automatic.
Yes, you have automatic and you have manual. You can set the
Can you
EV.
help us to because we never trained about this actually.
I read for
Manual.
Yes, I read in manual, and I found that you can change from automatic to manual, and you
So-
can set PV and
So we
milliampere.
can maximally lower from the absorption from
Yes.
for the bond we can give.
Yes.
Definitely. Thank you very much.
So the source of hazard will be scattered radiation coming from patient. Okay, scattered radiation coming from patient. So how to protect myself from scattered radiation? The risk of exposure to coming or scattered radiation coming from the patient will be cataract, orthopedic strain, or cancer. You will find here that this is the problems which may happen, okay, in case of fluoroscopy or operating theater. They found that when the worker, okay, a lot of workers pee beside the X-ray tube from the left side of brain are exposed to radiation more than the right side of brain. So they found that left side of the brain is exposed to 2x the amount of radiation as the right side, because they are directly or directly beside to the X-ray tube. They found that in a study of brain tumors in interventionalists, where tumor location is known, 86% occur in the left side. Okay?
So more than 3/4.
Yes. This is normal. Maybe after operation that you will feel that low back pain or that you are you feel fatigue. Okay. As we talked before, that biological effects of radiation. To memorize with me, okay? Deterministic effect and stochastic effect. Deterministic, okay? Those relations, there is a relationship between deterministic effect and those. But for stochastic, it is a probabilistic. No relationship between those and the effect of stochastic, okay? So, for example, for instance, for deterministic effect, hair loss, skin damage, tissue necrosis, cataracts, sterility, decreased white BC's count. But for stochastic effect, cancer and genetic defects, okay? Deterministic effect, which only occur above a certain dose threshold, but stochastic effects which have a chance of occurring at any range of doses. So, for deterministic, occur only at a certain level of dose, but for stochastic effect, no dose threshold. Here, as we see before with Dr. Saudi, you remember that we see this parameter, the fluoroscopic time, and we see those area product, DAB, and we find parameter K. Okay, this parameter K is called air Kerma. Air Kerma. Kerma means kinetic energy released per unit of mass. Kinetic energy released per unit of mass. This parameter, what's the meaning? What are the meaning of this parameter? Exposure time, okay, and the fluoroscopic normal or Barset, this is time, and the AK or K, its a unit is milligray. Unit for K is milligray, which is Kerma, which is mean Kerma. And those area product, okay, that mean the dose per unit of area, okay, milligray dot centimeter square, okay. What are these parameter mean? And this means that the patient are exposed to how many millisievert or how many milligray. Okay, we will learn today how to convert this value, okay, to an effective dose of patient. We will learn today to convert this value, okay, to the effective dose of patient. Okay, so fluoroscopic time is the time of exposure, air Kerma, as I told you before, that kinetic energy released per unit mass. But Kerma mean it is the dose at a certain point. You will find here that CR, okay, this is X-ray tube, and this image intensifier, okay? At the center, this region, center between image intensifier and X-ray tube is called isocenter, okay? If you measure 15 centimeters toward the X-ray tube, at this point is called Kerma, or K, or AK. Unit is milligrade. So at this point, 15 centimeters from the isocenter toward the X-ray tube or focal spot, this point is for Kerma. For Kerma at standard point, at standard point. This point represent deterministic skin effects. Skin effect. This point measure the skin dose of patient. This point measure the skin dose of patient. Okay, but for those area product, okay, this is the cumulative sum of instantaneous air Kerma and the X-ray field area. Okay, accumulative dose. Okay, not only Kerma but accumulative. Okay, and times the area exposed of patient. So this monitors the patient burden and is a good indicator for stochastic effect. So if I want to measure the effective dose of patient, what will I do? I'll get this value of those area product, okay, times tissue weighting factor. You remember? Tissue weighting factor, okay, for extremities, it will be 0.01. So when I multiply, okay, those area product times 0.001, so now you can calculate the effective dose of patient. Okay, so those area product times 0.01 for extremities, okay, as our job in operating theater for extremities, okay, you will find the effective dose of patient. Okay, here as I told you before, that the isocenter, okay, between the image receptor or intensifier and the X-ray tube, 15 centimeters towards the X-ray tube. This point is the point for calculation for Kerma, okay, kinetic energy release. So 15 centimeters from the isocenter in the direction of focal spot. Here, what the meaning by those area product? Those area product here, this is the X-ray tube, okay? Increasing is the distance, so the area which is exposed to radiation will be bigger, will be greater, okay? Will be increased. So here, small area is exposed, here, larger, here, larger. So you will find at greater distance, the area of exposed will be greater, okay? But the intensity of the radiation, number of photons is still the same. Number of photons is still the same. Number of photons which is coming out from X-ray tube here in this area will be here in the same number of photons, but the concentration is different. Okay, there is differences in concentration of number of photons. Concentration. Okay, here highly concentrated photons, here less concentrated, here very low concentration. So you will find here the dose here is different than in this area. Okay, on greater area, if you expose to large area, okay, if you expose to large area, so the dose will be decreased. So the dose will be increased. Here is the distance, okay, 50, and here 100, here 200, okay? So here you find dose is 4, here decrease 1, here 0.25. Okay? Here is,
Just cancel this file.
sorry,
Close your this file. Close on the computer.
this one?
No,
The pop-up menu. Close it on the computer.
Yes.
Close on the computer.
Here you find dose, okay? Here you will find area of exposure. Area is increased, okay? 1 become 4, become 16. Here those area product will be the same, okay? Okay, why? Those area product,
Same number of photons.
same number of photons, okay? But increasing the area, okay, with less dose, okay, you will find that the product of those times to area will be the same. Okay? Okay, because increasing area but less dose. In here you will find that area is small area but the dose is high. Okay? So what now you understand what I mean by the same number of photons, same number of photons. Okay? So this value of this dose area product will convert to effective dose when I multiply this dose area product with conversion factor which is 0.01 for extremities. Okay? To protect ourselves, ALARA concept, okay, as low as reasonable achievable, okay. Sometimes you will find worker working in operating theater or fluoroscopy, no idea what I'm doing, okay. But here, I know what I'm doing well, okay. I will follow ALARA concept, so it's good, okay. So you have to follow ALARA concept. Safety first, safety starts here, think safe, work safe, be safe. This for worker, okay, patient, image intensifier, X-ray tube, you'll find here that our lens is exposed to radiation, finger and hand are exposed to radiation, okay, and this region, neck, are exposed to radiation, and these are the locations for personal dosimeters, okay, to measure the lens dose, to measure the neck dose, to measure our total body dose, and to measure our hands dose, okay. You'll find here 4 locations for dosimeters, and
the force behind you.
yes, here underneath.
Behind the
Yes, yes, behind. Okay, so
it would measure the absorbed dose.
absorbed dose. It will be, this is the effective dose of patient, okay, because X-ray and gamma ray, the quality factor is 1. So no difference between the absorbed dose and the effective dose for gamma ray or X-ray, okay. So here, at least you have to wear 2 personal dosimeters, at least.
One outside, one.
Yes. If there are heavy workload, okay, you have to wear one under the lead apron and one above, at least. Okay. Sometimes when operating in operating theater or fluoroscopy, what's the table position? What's the proper table position to protect myself? Okay, here you will find that the distance from the X-ray tube to the patient is 80 centimeters, and the distance from the table to the image intensifier is 30 centimeters. We will find the dose is 1 dose unit, okay? But if we decrease the distance between the X-ray tube and the table, okay, we'll find the dose and the same distance from the table to the image intensifier, the dose become 1.4 dose units. Here, when I increase the distance between the table and the image intensifier, the dose here is 2.6 dose units. Okay, so you have to put the table in a great distance from the X-ray tube, okay, to protect yourself and to protect your patient. Okay, and you have to put and you have to close the image intensifier as much as you can to the patient. Okay, this is a proper way for imaging the patient operating theater.
To reduce the absorption.
Yes, yes, to reduce the absorbed dose to patient and the worker.
Into the work.
Okay, great distance, at least 8 centimeters, okay, between the X-ray tube to the table, and to close the image intensifier to patient.
But why is the extension of the distance between patient and the image intensifier so important? I don't understand this one.
Where?
Because it's multiplying the dose, yeah? The
Yeah.
difference between patient and the image.
Yes. Why when we increase this distance, the dose increased, yes?
Yeah.
That's your question. Good question. Okay. If I close the image intensifier to patient, okay? So, all the scattered radiation coming out from patient
Yes.
will be absorbed, okay? Totally absorbed. But if we increase the distance between the image intensifier and patient, so the probability of photons coming out from the field of view of image intensifier will be increased. So, as a worker, I will be increased. I will absorb a lot of radiation. Okay?
Yeah. So that means put the X-ray tube closer to the patient.
No.
The-
X-ray tube will be
As far as possible.
yes.
But
Be far away from the patient. But image intensifier, receptor,
Oh, yeah.
the detector, be close as much as you can.
This bigger tube, it is the image, it is smaller, is the X.
Okay? For thick patient, okay, you have to reduce the X-ray tube to patient to get a good image quality. But you have to know that now you increase the patient dose and you increase the scattered radiation to the worker. So you have to make an optimization. Okay? Okay, that's very important. Because in only fat patient, you need to close. In only fat patient. But not all patients. For thin patient, it's okay. And if we expose a small area of patient like leg or hand, no need to expose all parts of patient. No need to expose all parts of patient. Okay? It's only the organ, okay? You have to expose it. Here is it. C-arm position and the angle of CR. Sometimes will be the X-ray tube in the bottom and image intensifier in up position, okay? But sometimes you will angulate the CR to be side position, yes? Okay. What's the exposure in the two cases? Here you will find the small exposure, okay, when the tube in upright position, in this position, and side position, no. The dose will be increased. Why? Because large thickness of patient, here, you will find this small area of patient are exposed to radiation. But here, you will find that, yes, big thickness of patient will be exposed to radiation. So scattered radiation will be increased here as well. So side position, increasing the dose to patient and worker. Okay?
The same as with the X-ray, we have from the lateral chest X-ray small radiation.
Yes, yes, because higher thickness, okay? So when you angulate the X-ray tube, what will happen? The distance here from X-ray tube to patient is around 8 centimeters. When you angulate the tube, okay, this distance is decreased.
Decreased, but the absorption is
Absorption is increased because the distance here is decreased. So you have to take care of this point. You have to take care of this point. Okay? And the very important point, you have not to focusing on a certain point. Okay? If you focus on certain point, you have to angle the X-ray tube a little bit. Okay?
Good morning to you all.
Another point.
Announcements to be made.
That's
First one
good
goes
for
we have
for
some
patient
notified reports at the AOPD. Suppose you want Sigma Horseman install living rooms, low AOPD, or woman married to work, or companies, low patient, or diploma and married adult outpatient. You can move in more cargo play you, na laran room free, na more woman, na work married can screening on patients. Only like work